Dr. Gullberg here, continuing our internal medicine lecture series. Today we're talking about myocardial infarctions. Specifically, we're going to talk about the TIMI score as well as some of the cardiac enzymes. So there's a scoring system for MIs and regarding mortality in the first 2 weeks after the MI. It's called the TIMI score, the TIMI score, which stands for thrombosis in MI. And there's a nice mnemonic called America. It's a 7-point mnemonic. So A stands for age greater than 65. M stands for markers, which are increased. E stands for ST segment changes. R stands for risk factors, and there needs to be 3 or more risk factors from age, family history, diabetes, high cholesterol, hypertension, smoking, obesity, sedentary lifestyle, metabolic syndrome. I stands for ischemia, 2 or more anginal events in the last 24 hours. C stands for coronary artery disease, prior 50% coronary stenosis. And A stands for aspirin use in the last week. So the point scoring system is 0 to 1 is a 4.7% mortality rate. 2 to 2 is an 8.3% mortality rate. 3 is a 13.2% mortality rate. 4 is a 19.9% mortality rate. 5 is a 26.2% mortality rate. And 6 to 7 is a 40.9% mortality rate. Secondly, let's talk a little about biomarkers, cardiac biomarkers. Troponin certainly is the most sensitive and specific test for myocardial injury. It's better than the CPK-MB fraction. It peaks at 12 hours, and it's released in 2 to 4 hours after the infarct. Stays up for about 7 days. Unfortunately, it can also be elevated in pulmonary emboli, CHF, and even myocarditis. Other markers that you need to be aware of are the LDH1 marker, the AST, myoglobin, BNP, IMA, which stands for ischemic modified protein, and the GPBP, which stands for the glycogen phosphorylase B marker. Those latter 2 are rarely used, but just so you're aware of them. So hopefully this summary on TIMI and biomarkers will help as you evaluate patients with MIs. Thank you, Dr. Gullberg, signing off.